Today I'm going to talk about labiaplasty surgery. It's a surgery that's becoming very popular in my practice. I do about 2 or 3 of these a week. The women who come to see me are quite emotionally distressed. They've been having concerns about this for many years. They really don't know where to turn to. They have gone to the internet, and that's how they've gotten information about this. And so they are somewhat knowledgeable, but don't have all the knowledge about it. Most issues are either with the appearance of it being either too large, and so they're uncomfortable with the appearance of it, or it could be functional. It could be that the hypertrophy of the labia causes discomfort with clothing or certain activities like riding a bike, horseback riding, and occasionally it could be issues of having, because of the increased size of labia, you can actually collect more moisture in those areas, and so issues with having chronic yeast infections. In fact, I've had a few gynecologists send me their patients with these issues because of chronic vaginitis. And occasionally reducing the labia will also resolve those issues as it decreases the amount of moisture in that area. Women that I do labiaplasties are, it really run the gamut of age, all the way from very young women. I've had women as young as 14 come in with their mothers who've been recommended to me by their pediatricians, all the way to women in their 60s, and certainly all walks of life, housewife, students, lawyers, pilots, judges. I mean, it's every woman. And this can be an issue with. The labiaplasty surgery is a relatively straightforward surgery. During the initial consultation, I go over in detail with the woman exactly, first if she's a candidate, of course, and then if she is, exactly what I'm going to be doing in surgery. First we go over her anatomy, how that may be different from another woman's anatomy, what I'd be doing in surgery, how much I'd be removing, what I'd be leaving behind, and so forth. And at that point, it's pretty open. I have the women ask me questions. And certainly, our offices, it does so many of these that everyone in the office is very familiar with the procedures. So even after the consultation, if they have questions, they can easily email or call us. Sometimes we do get consultations from away from the Bay Area, and we get pictures and emails regarding their questions. The surgery itself is done as an outpatient procedure. It's done under very light anesthesia, but the patient is completely comfortable. She will not feel anything when the actual surgery is going on. The surgery itself takes about an hour or so, and the patient is in the office for approximately 2.5 to 3 hours. She does need to have someone take her home, and generally recovery is quite fast. Initially, we have her take about 3 days of complete bed rest with icing the area. Then she can get back to work and do some light activities. Full recovery is approximately 3 weeks or so when the sutures have all completely fallen off. If you have any other questions, feel free to give the office a call or email me, and I'll be happy to answer your questions.